Welcome. My name is Keith Knabb of Affordable Medicare Solutions. We're Georgia's largest Medicare planning agency and the most award-winning Medicare planning agency in Georgia. Today, we're going to talk about signing up for Medicare. Medicare can be a process. It can be a bureaucracy. So we're here to help you. That's our job. There's not just me. There's 10 of us here working year-round to be your Medicare Resource Center to make sure that you and your friends are taken care of and not just calling some 1-800 number. So let's get to the presentation. Signing up for Medicare. So what is Medicare? Well, Medicare is health insurance for people 65 and older in the United States, or also people that are under age 65 that have certain disabilities. We have clients that are 20 years old that have Medicare, and also people with things like end-stage renal disease or Lou Gehrig's disease and other tragic illnesses. The types of Medicare. Well, there's 4 different parts of Medicare. The government has done this over the last 50 years of improving and changing Medicare. The first part was created in 1965. That is Part A of Medicare, which is your hospital coverage, and then Part B of Medicare, which is your outpatient coverage for Medicare, so inpatient and outpatient. And then there's a new part of Medicare that was created in 2005 called Medicare Advantage. That's Part C. And then there's Part D, which is also created in 2005, and that is your drug benefit coverage. So how do you obtain Part A and Part B, which are the foundation of Medicare, the inpatient and outpatient coverage? Well, you have your initial enrollment period. And your initial enrollment period means you're turning 65 years old, or you were just awarded Medicare through a disability award from a judge. Now, if you're already receiving Social Security benefits or railroad retirement disability benefits, you'll automatically get Part A and Part B starting the first day of the month you turn 65. So it'll just show up in the mailbox. You'll have a card that shows up 3 months prior to your eligibility month. It'll be the first of the month that you are eligible. So the first of the month that you turn 65 or that you're awarded Medicare. You're going to receive that card in the mail automatically if you're receiving Social Security disability benefits. If you're not receiving those benefits, that's fine. You'll need to then go sign up for Medicare. So think about this. A lot of people are postponing or delaying the start of their Social Security income. Maybe they're still working past age 65. Maybe they want to wait until age 70 so that their Social Security check gets larger. It's your choice. You don't have to start Social Security when you turn 65. So many people are waiting after 65. That means you go sign up either by going to the Social Security website, which is ssa.gov/online services, or you can call Social Security. And preferably you want to call your local office, not the main national number. Just call your local office, Google that phone number. They will help you if you have any trouble with your online account. Now, I'm going to give you one warning about your online account. If your personal credit history is locked for your protection, which I do for myself to prevent identity theft, then you're going to have to do a temporary unlock of that block so that Social Security can verify your identity online. That is a classic problem people have when they go to use the online service. So be very careful. Now, special enrollment periods. Special enrollment periods mean you can sign up for Part A and Part B anytime you're still covered by your employer plan or group insurance. So a lot of people are working past age 65 and they've still got their employer insurance. They're working for IBM or Coca-Cola, someone, and they say, you know what, I've got great group insurance. I'm just going to wait and sign up for Medicare later. That's fine. You can do it anytime while you're working. You can go sign up for your Medicare, but you'll need to have proof that you have that group insurance in place in order to avoid penalties. But if you fail to enroll while you were working and you've gone ahead and retired, you have an 8-month window that prevents penalties to show them, hey, up to 8 months ago, I had group insurance. And you can show that. That's an 8-month period, which prevents those penalties for failing to sign up for Medicare properly. The form that I was speaking about is called the Employer Verification Form. And that form is signed by your supervisor or someone at your human resource department at work that says, hey, you had great group insurance and now you're leaving that plan. That's fine. That'll prevent any delay and penalty. The employer verification form is shown here on the screen. It's really simple. You put your name and social security number, and then the employer fills out the section B of the form. You can call my office and we'll email you this form. That's no problem. The signature of the company official is shown at the bottom left-hand corner of the screen, and the title of the company official. Medicare does not care, and Social Security does not care if this is your supervisor, your manager, the president of the company. They don't care. They just want a company official and a title there. These forms are, I've never heard of them being audited, but they just have somebody sign that for you. Now, the way to sign up for Medicare, we told you can go to the Social Security Administration's website, not Medicare, but Social Security, ssa.gov. You could call the national number, which is 800-772-1213, but generally you want to call the local number. They're going to refer you to your local office. So just Google your area and the Social Security office, and you'll see the number. Once you're enrolled, you're going to receive a welcome packet in the mail, a little small 6x9 envelope, very plain, but it is from the government. And inside there will be a paper Medicare card. Isn't that incredible? Then the year 2022, the government is still printing paper Medicare cards. That's crazy, but that's what you're going to get. Don't throw it away. Get it laminated. You're going to need to use it a lot. So the Social Security's website is very simple. You go to this Social Security website, and in the top right-hand corner, it says sign in or sign up. Well, that's where you can create your account. It says to create your account, the information you'll need is a valid email address, your Social Security number, your U.S. mailing address, and you got to be at least 18 years old, of course, to use the online services. Once you do that, creating that account, go back to on the main page where it says Medicare enrollment. This second box to the right says Medicare enrollment. You click there and you'll be taken to where you can sign up for just Medicare and not your Social Security check. It's your choice. So the next steps, while you're waiting for your Part A and Part B to be fully awarded to you after your request, that's the time period. That's going to take 2 or 3 weeks for them to process that. That is your time period to do your free Medicare plan review to find the right options with our agency. There's a no charge for these services. And then once you receive your Medicare card, you can go create your Medicare login, which is important to have a Medicare.gov login once you have your Medicare ID number that comes in the mail. We can also check with your current doctors to make sure that they take Medicare. I can research through our online services, or you can call your doctor and make sure that they accept Medicare. You can also check with your dentist, not to see if they take Medicare. You want to check with your dentist to see what insurance networks they're a part of. So don't ask your dentist, do you take Medicare? Because they don't. You want to ask them, what networks are they truly a participating provider? Make notes of that. That's important. Don't fall prey to when a dentist says, oh, we take all of those plans. No, ask them specifically what plans they take. And then you'd also want to then set up your review for your annual review each year between October 15th and December 7th. So at the same time we're doing your initial review, we can go ahead and book for you to see us in October to do the next year's review for 2023 and future. Now, once you do get this Medicare ID number from Social Security, you'd want to go to this Medicare.gov website, which is really effective, and we'll show you more about this. You take that number and you can put it in and create your Medicare login, different password than your Social Security login, and you'll be able to manage your Medicare account there. We need this account to help you manage your account, manage your benefits also. But if you need a temporary ID card, if you accidentally lost or put your Medicare card through the washing machine, you can print a temporary replacement and you can ask for a replacement card. Also, at your Medicare account, we can see the in-force status for all the Medicare plans you have, or your son or daughter or spouse who is taking care of you when you are sick can also see your in-force status. So you want to share this Medicare password with your loved ones so that if something happens to you and you have a stroke or have COVID, you go to the hospital or incapacitated, somebody else can see your Medicare account. Every year, though, we go into your Medicare account with you and we can analyze and select new Medicare plans, such as your drug coverage or other coverages, to make sure that you're fine for the upcoming year, because the plans change and their elements change every year. So the Medicare account is really simple. You just go to the Medicare main page and it says no account, create one now. You just click on those buttons. It's very simple. Your name, your email address, your Medicare number, your date of birth, and the time when your Medicare plan started, the date. Very simple. So once your Part A and Part B is awarded, my staff at Affordable Medicare Solutions will do the enrollments into the plans that you have chosen. We are just your enroller. We get paid by the system. The system takes care of us, no charge to you. And then we track the enrollments and we make sure that they're approved and there's not any snags. We will notify you about your approval. Of course, in the mail, you'll also receive your welcome packages from the plans, but you need to have an advocate, and that's us. We're your advisor and you're an advocate to make sure that things aren't stumbling, there's no obstacles, make sure everything gets taken care of properly. Also, if you are at the very last date of a month and you're like, hey, Keith, I need to have an ID card tomorrow, we can oftentimes go in and print out temporary ID cards and email those to you so that you can print them out, so that you can use them at your doctor's visits in case they haven't come in the US mail. So thank you very much for joining us today. Don't forget that everything that we do is free. There's no charge for our Medicare planning services. It's a no-brainer to use my staff. We take care of you and your family's needs. Thanks again for joining us.